Today we are going to talk about the health of women's private parts and the things between couples. First of all, we have to know that it is a normal physiological phenomenon to have hair in the private parts, and the amount of hair is different for each person. Why is this? This is related to the hormones in each person's endocrine. The growth of private hair is related to the level of sex hormones, especially androgen. If the level of androgen in the body is low, or the hair follicles in the private parts are not sensitive to androgens, the hair in the private parts may be sparse or even absent, which will make people feel that the private parts are very. However, don't think that less hair is a good thing. The hair in the private parts has many benefits. This hair is like a natural barrier that can resist bacteria and viruses, protect the private parts, and reduce the possibility of illness. During sex, the hair can also absorb the mucus secreted by the sexual organs, reduce friction, and reduce the risk of injury. This hair also has a warming function. It can play a certain role in regulating temperature in the private part. Even if there is not much hair, it can keep the private parts warm. The hair follicles in the hair can help discharge metabolic waste, such as sweat, prevent the private parts from being adversely affected by these metabolites, and can also emit sweat. Let's talk about the color of the private parts. There are many reasons for the darkening of the private parts, such as genetics, changes in hormone levels, and aging, which are all related, and there is no necessary connection with the frequency of sexual. Different races or individuals have different skin colors, and genetic factors have a great influence on the color of the private part. During puberty, pregnancy, and menopause, when women's hormone levels change greatly, changes in estrogen and progesterone will also affect the color of the private part. Moreover, with age, skin pigmentation will increase and the color of the private parts will become dull. In addition, excessive friction or the use of irritating cleaning products may also cause pigmentation, making the private parts dull. Although sexual life may cause temporary color changes in the private parts, long-term color changes cannot be blamed on frequent sexual. If women find that the color of their parts has changed significantly, they can clean and exfoliate appropriately. Regular exfoliation can remove dead skin cells and make the skin. In normal times, drinking more water can also maintain skin health. If in addition to the darkening of the color there are itching, pain, or abnormal secretions, then you have to see a doctor to see if there are any health problems. Although the darkening of private parts has nothing to do with sexual life, if it suddenly turns black, it may also indicate some health problem. If the skin barrier is damaged, it will make it easier for harmful substances from the outside to enter the skin and cause an inflammatory reaction. Inflammation will stimulate melanin to protect the damaged area, and the skin will become darker. In addition, the damaged barrier will also cause the skin to lose moisture and become dry and rough. Endocrine disorders will also have an impact, causing an imbalance in hormone levels in the body and affecting the synthesis and metabolism of melanin. For example, unless your estrogen and progesterone is unbalanced, it may promote melanin synthesis and make the skin darker. Then there is skin inflammation. Whether it is caused by infection, allergy, or other stimulation, there will be symptoms such as redness, swelling, and itching. It will also damage the tissue structure and stimulate melanocytes to produce more melanin, resulting in pigment. After talking about women's private parts, let's talk about what men should do to protect the health of women's private parts. Some married women have sexual indifference, which may induce many diseases. Women with normal sexual life have cyclical changes in congestion, swelling, and subsidence in their reproductive organs, which is good for blood circulation. If there is sexual indifference, congestion and swelling will not subside easily or will not subside completely, and swelling will cause pain. Moreover, studies have found that sexual indifference or disharmonious sex life is an important cause of breast hyperplasia, and depression and anxiety caused by adverse mental stimulation are also catalysts for breast lobular hyperplasia. So, men should communicate well with their wives frequently to make them relax, happy, and have a healthy sex life. Also, if there is bleeding after sex, cervical polyps may rupture and bleed during sex, and the husband may find blood after sex. If the husband is healthy, you have to consider whether there is a problem with his wife's cervix. Early symptoms of cervical cancer may also be vaginal bleeding after sex, and bleeding may be caused by impact on the posterior wall of the bladder or the cancerous tissue itself. If the wife has hematuria after sex, she should go for a checkup early. Men should carefully check whether there are any subtle changes in their bodies and their wives after each sex. Unforgiveness sex is one reason. Bacteria are hidden in the nails. If your lover keeps his nails and does not wash his hands when caressing, you have to be careful. If the cleaning is not in place, or if you are too lazy to urinate or wash after sex, it may cause genital tract inflammation. The most obvious manifestation of genital tract inflammation is abnormal leukorrhea. Normal leukorrhea after puberty is colorless, odorless, transparent, and has the function of moistening and lubricating the vagina. If the amount of vaginal discharge increases and it looks like cheese or tofu residue, or it turns yellow, green, and has a fishy smell, it is abnormal and may be genital inflammation. Men must do a good job of hygiene before sex, clean their private parts dry, change their underwear frequently, and it is best to wear breathable and loose cotton underwear, which is much better than tightened. Life pressure also affects sexual function, such as excessive selfishness, extreme authoritarianism, and quarrels over trivial matters of money and power will make wives feel disgusted and indifferent to their husbands sexually. Men must take the initiative to deal with family conflicts only when the relationship between husband and wife is good in the family. Dear friends, understanding this knowledge about the female body is not to pry into privacy, but to better understand the female body and physiological changes. Whether it is women themselves or male friends, they can have a more comprehensive understanding of women's health and sexual health through this knowledge, so that we can take better care of ourselves and the people around us in life. I hope that what I said today can bring you some new insight. Let's talk about more interesting topics next time.